me, I'm Representative Mason. I know that you are a smart guy who is committed to real principles and constitutional values in the state, and I know that. But when you talk about poverty, I can't tell you how disconnected that feels from the people in my community that I serve, who are struggling with poverty and working jobs and trying to get back on their feet. How absolutely disconnected the way you described the world that you think they live in from the reality that I see every day. When I go back to my district, there are people working a minimum wage job, or a job working $9–10 an hour, trying to make ends meet. To say nothing of the chronically unemployed at 13%, to say nothing of what we're going to do here. What you're talking about is being acceptable with a tax that could be somewhere, depending on whether or not you're single or family, that could be somewhere between 10 to 30% of their annual income. That's what you're talking about, subjecting those 84,000 Wisconsin residents to. I mean, you would never find that acceptable in any other part of the economy. You know, I mean, later, I think we're going to hear something about a tax break that on average, near as I can tell, gives somebody making about this amount of money $9 a month, right? But at the same time, you're going to ask them to pay health insurance copay that could be 10 times that, 20 times that, to have access to Badgercare. It would be easier to take the conversation about upward mobility and where things were going if we were actually investing in policies that were making it possible for the working class to get into and stay into the middle class. But we've been here week after week, making it harder for people to get uninsurance employment, making it harder for people to have food stamps, making it harder for people to get access to job training, making it harder for K-12 schools. We're going to have a debate later about K-12 education in public schools. And then where we're going to put our resources in terms of a tax cut, about whether or not that's going to benefit people who make hundreds of thousands of dollars a year compared to a normal working class, maybe single mom making 20, 22 grand a year, trying to get by. So when I listen to you talk about what the opportunities that would be there, or that their minimum wage job is only a temporary thing, when there are hundreds of thousands of people who make minimum wage, where that's the only wage for their household. That's it. And they're maybe working 2 or 3 jobs, trying to make ends meet. When you talk about this stuff, it is so disconnected from the working people in my district who are working so hard to make it into and stay in the middle class. And when you talk about taking away the opportunity for them to be enrolled in Badgercare, and the real opportunity that would provide for economic stability, to say nothing of the health care benefits. Again, that woman's outburst wasn't appropriate, but when she was leaving and saying, "Help me," well, I don't think that's what we're doing here today. I think we're making it a lot harder for people like her, or working class citizens who have jobs, who have families, to make it. And every indication that we seem to get from this committee is that we're going to make it harder for working class folks to make it in this state. Easier for the rich folks, but harder for working class, normal middle class Wisconsin citizens to make it. Representative Koiga, I have to respond. It's a comment that's come up a couple times about what the reimbursement rates are going to be like. That it might be 60 cents on the dollar for some MA patients and 20 cents on the dollar for some others. The number that you all keep missing to average into this is 0. Because that's how much reimbursement you get when somebody walks into the ER who has no coverage. 0. So we're not talking about whether or not you're going to put people in a position about whether or not they're going to get reimbursed hospitals at 40 to 60 cents on the dollar versus 80 cents on the dollar. Again, if we were talking about that, I'm sure the hospitals and providers would be here in droves supporting this plan. But they're not. Because they know, in one hospital in Racine alone, $23 million a year in uncompensated care. So when you talk about your plan, the big number you leave out is 0. Because that's the reimbursement rate for the uninsured when they go to the ER. 0. But it's not just an empty number. That number then just gets passed on to employers and to other providers and other normal citizens who have private sector health insurance who wind up picking the tab for all those people that you're leaving behind here. We have to talk about this in a way that's honest. And in all earnestness for my colleagues on the other side of the aisle, because I've heard some of the comments you've made about working class folks that I feel like you clearly don't really have a grasp of what's going on, I would invite you to my district to come and meet some of those people and hear the struggles that they deal with on an ongoing basis. And I mean that in all sincerity, because I know that you are serious people who look at this stuff, but I think you are missing the real world implications of what's going on here, to say nothing of the fiscal impact. People making 20, 25 grand a year who have a couple kids, their child care costs, their debt costs, with the cost of rent, the cost of health care, they are struggling to get by. And for a lot of people, for 84,700 people in this state, you're taking away one of the best opportunities they will have had in a long time to try to climb up that ladder you were talking about and maybe make it into the middle class.